into the workshop arranged on global women leadership by Royal College and PSIM collaboration. It shows a promise and potential for the emerging women leaders. I would now like to invite on stage Dr. Somia Iqtadar, a woman in healthcare leadership, who is not just breaking the glass ceiling, she is building staircase for others to follow. Dr. Somia is going to present her talk on advancing women leadership in healthcare.
Presentation, and I'm so happy that we could provide a platform for the emerging leaders, and you were brilliant. Ladies and gentlemen, gender equity is imperative to the attainment of healthy lives and well-being of all of us. And promoting gender equity in the leadership, and particularly in the health sector, is an important part of this endeavor. So gender equality ranked from the World Economic Forum measured gender inequality in 149 countries with an index based on 4 criteria: economy, education, health, and politics. And ladies and gentlemen, you will be very disappointed to know that Pakistan came 148th in the list of 149 countries. In terms of gender parity, the ranking shows that Pakistan is amongst the worst performers in gender equality. According to this report, 4 Muslim countries, Egypt, Saudi Arabia, Yemen, and Pakistan, are the 4 worst performers in the world where the number of women holding the managerial positions is the lowest. And we were followed by Yemen, and we were 148th. Yemen was 149th. So today, I'm talking to you about how we can advance women leadership in healthcare. I'm very grateful for this opportunity today to speak to all of you. Let's go back to our medical schools. When we used to study, there was majority of male students. But when I look in the class today, when I'm taking the final year class of medicine, 70% of the students are females. In some colleges, even 80%. And there are only 30%, 20 to 30% are the male students. This is the data from the Rawalpindi Medical University. I wish Professor Umar was here to support that there are 2,530 female students against 1,089 male students in Rawalpindi Medical Universities. So we have a lot of female representation in medical colleges. But where do all these women go? Why don't we see them advancing in the health sector? So when we talk about leadership in the healthcare, women who make up the 70% of the world's healthcare staff, only 25% are seen as a senior leader. It takes women 3 to 5 years more to reach the CEO positions, and women make up only 30% of C-suite executives and 13% of CEOs across healthcare. And if we talk about low and middle income countries, then 83% of the global population lives in low and middle income countries, and only 17% are high income countries. And out of these 83%, only 17% are in the leadership positions. And out of these 17%, only 5% are women. And if you compare them with the high income countries, which are only 17% of the world, 83% of them are global health leaders. And about 50% of them are just from 2 countries, UK and US. So if you compare the total number of women leaders, which is about 5%, and you take the total leaders who have graduated just from Harvard, this is an equal number. What a disparity. So there are a lot of challenges and barriers that the women have to field to become leaders, and particularly in the health sector. We tried to study in I searched multiple literature to see what are these barriers so that we can address them. So 47% of the women, they thought that the work-life balance is the greatest challenge. So 47% of the women, they thought that the work-life balance is the greatest challenge. Negatively affecting the childbearing decision was at 37%. Gender discrimination included made to feel inferior was 37%, and unwelcome sexual advances in 29%. But let's have a local data as well, because that is what we need. So this study was designed by Dr. Shabnam Sarfraz. She could not join in person today. She was joining online, but sadly we had to shift. So this is a study in which she studied two main things: features of the mentorship programs for women in global health and gender transformative policies. And they wanted answers for three prime questions. First was, what has worked for gender equality in Pakistan leadership? Second, what specific barriers disrupt the career progression of women in health sector in Pakistan? And third, what is needed to improve this gender equity in healthcare leadership? And 65% of the women leaders said that they faced gender-specific barriers in their career progression. So this is the main hindrance in their career progression. Apart from them, there were other policies also which played a role. So almost 1/3 of the respondents cite that competing responsibilities of family and not having a daycare facility is a hurdle for advancing their career further. And they said that 45% rendered lack of mentorship as a barrier to advancement of their career. And when they were asked about the least supportive relations, 40% cited that their supervisors or their immediate seniors, they were responsible for this. And 35% quoted that their parents-in-law are the least supportive in anchoring their careers. So this is our local data. So what are the enablers of the global women leaders? Obviously, training and mentorship opportunities are the biggest enabling factor in the career progression. And we all know that women are excellent leaders. They are task-focused. They prefer to work in collegial atmosphere. They promote cooperation and collaboration. They have an excellent communication style. They have self-branding, and they like to practice the transformational leadership style, which is very effective. And we've seen that the action of female leaders during the COVID-19, particularly in New Zealand, Denmark, Finland, Germany, Iceland, Norway, and Taiwan, which were all led by women leaders, they had an excellent response. And this is a research study conducted by the University of Liverpool and the University of Reading, which titled "Leading the Fight Against Pandemic, Does Gender Really Matter?" And ladies and gentlemen, gender does matter. Women are better leaders. Women perform well in multiple aspects of leadership and are critical to the healthcare industry. In 2021, McKinsey and Company and Leading.org found that within 43 companies across the US and Canada, women were better than men at providing emotional support to the employees. They were 31% superior in contrast to men who were only 19% in that survey. Considering the well-being of employees, women took the lead again with a 61% figure against 54% of men. Helping employees navigate work-life challenges, women performed better. Intervening to prevent or deal with employee burnout, 16% of men compared with 21% of women. And leading and supporting diversity, equity, and inclusion efforts, again, 11% of women against 7% of women. So every woman can be a leader. And no woman should ever grow old before knowing her true potential. And this was quoted by Socrates. So, ladies and gentlemen, in the journey of the women's leadership, we had to look for something which can help us. And Global Women Leaders Program by RCP London emerged as a guiding force. Their vision extended like an umbrella, steering us all. And the great efforts were then joined by Pakistan Society of Internal Medicine, and with the pivotal support and strength of Women in Global Health, and the determination of WillMed and initiative of Feroz Sons, and Unity of Women as One, we have risen as leaders, holding this umbrella, making it stronger, empowering women together for a brighter future. And here I stand in front of you in a hall full of men and few women, talking to you about Global Women Leaders Program, and PSIM is taking this forward to address the challenges of how to motivate and inspire women to aspire towards leadership roles as a key strategic goal. So we are working on 3 thematic analyses. 1, practical difficulties, including the childcare needs, lack of timely career advice, and part-time working with flexible time for women. Then social barriers, including maternal identity and cultural pressures with respect to work and family balance. And third, the importance of building resilience through role modeling, mentorship, and support from one another. From this forum, we have started the Royal College of Physicians and London Global Women Leaders Program, Women in Healthcare Leadership, led by Royal College of Physicians by Dr. Mumtaz Patel, who's the Senior Census and Vice President, Education and Training at Royal College of Physicians, London. And from from Pakistan Society of Internal Medicine, Professor Javed Akram has been the anchoring force to initiate, give me the idea, and making me talk to Mumtaz Patel to take this and bring it to Pakistan. I'm very honored and I'm very pleased that I talked to Mumtaz Patel that night when we discussed this idea, and in a time of 6 months, we were able to implement it here in Pakistan. And Pakistan is the first country where the Global Women Leaders Program of RCP London was initiated. The second one is Sudan. The Royal College of Physicians London very proudly writes about it in its newsletter every time. They quoted Pakistan as an example, and they publish about it, and they very proudly present this program in all their conferences on women leadership and quote Pakistan program as a part of it. The 3 days workshop on women leadership in healthcare, which was organized in collaboration with Royal College of Physicians London, was a huge success. After this, we got in touch with so many physicians, brilliant physicians, women physicians from all over the country, and we are constantly getting requests for the third cohort for continuing this series to a major of event. So we have now joined the initial champions, of which I was a part, to the Emerging Women Leaders Program into a mentor-mentee relationship, where the champions will mentor 1 or 2 mentees, and then the chain will continue. The Women in Global Health, Pakistan has been very supportive on all these initiatives. I know Dr. Shabnam Sarfraz for a very long time from health sector. She's been always an advocate of women healthcare and leadership, and she's herself a very, very brilliant healthcare, public health specialist and a women healthcare leader. So we've done a couple of meetings with her. We are trying to bring all these programs under one umbrella so that we can come out with something constructive. We took a power delegation to the Gender Equality Forum in Paris in 2021, first time from Pakistan. A power pack forum from leading consultants from diverse fields of medicine. They represented women physicians in Gender Equality Forum in Paris. Then came the WILMED. I'm very thankful to Feroz Sans and Mr. Usman Khalid Wahid for taking this initiative of forming Women in Leadership League in Medicine. This is a homegrown project. This is Pakistan-based project, so we own it with full determination to take it forward. We'll meet Strategic Congress. This is an initiative of Feroz Sans. Then it is also joined by foreign delegates from Boston Scientific, along with female icons of health industry. And we have our Strategic Congress a few months ago in the Pakistan Cardiac Society Interventional Cardiology meeting. And from there I got an opportunity to represent in Women in One session, which is a UK-based organization, which is again supported by Boston Scientific, in the Euro PCR, which is a wonderful experience sharing and networking event for women in medicine. So I would like to end my talk here by saying that a woman is like a tea bag. You cannot tell how strong she is until you put her in hot waters. And women in healthcare leadership, may the force be with you. Thank you very much.